Reminder that it's extremely important that hospital and urgent care facilities and doctors' offices are not packed with those people, so those who need treatment, coronavirus or not, can get the care they need, which is why, as our Bill Miston explains, telemedicine is an important part of preventative medicine.
I think we're all very hyper aware of how we're feeling these days. If you wake up in the morning with a sore throat, is it from some dry air or is it something more? Normally, you would call your primary care doctor and schedule an appointment. But over the last several years, telemedicine has grown, and health experts say it's an important part of this current fight that we're in. It's been said that 90% of a diagnosis is a conversation between a patient and a caregiver. But that conversation doesn't have to happen in person.
Telehealth has always been here. Even before COVID-19, its use was expanding, but especially in this sort of pandemic period that we are in, telehealth, telemedicine is especially valuable.
Okay.
Valuable to keep those who are ill at home, keeping themselves,
Great job.
other patients, and those providing health care to others healthy.
Awesome. Look at that.
The simplest form, a simple telephone call, to interactive visits and face-to-face meetings over video, from primary care physicians to dermatologists. The option being urged for those with allergies to earaches.
Delivering clinical care, from one site to another through electronic communications is really what telemedicine or telehealth is. It's very clinically appropriate for lots of conditions.
Just last week, federal government saying it will loosen restrictions and expand telehealth access for those with Medicare, and urging states to expand service to those enrolled in Medicaid, those with low incomes.
Medicare and Medicaid now have really expanded that in light of the COVID-19 epidemic in terms of what they'll pay for telehealth.
So how much does it cost? Well, that all depends on the type of private health insurance you may have. Some providers have started waiving fees, so it's always important to check in with your healthcare provider or your employer. What if you don't have health insurance, though? Well, you can pay for telemedicine out of pocket, and those prices, they can vary. And keep in mind, though, a doctor that you see via telemedicine may still refer you to a doctor for an in-person visit. Bill Miston, Fox 6 News.
It's a safe